Hello, welcome to this presentation. My name is Rob Power. I'm a mobile learning researcher and I am the president of Power Learning Solutions. I have also spent a number of years as a member of the executive committee of a group called the International Association for Mobile Learning. I was elected president of IMLearn at their annual general meeting in Larnaca, Cyprus in November of 2017. I just wrapped up my 2-year term as president of the association. I've also spent some time working in the healthcare sector as the leader online learning for the Fraser Health Authority in Surrey, British Columbia. As part of my role with the Fraser Health Authority, I spent a lot of time working with a consortium of health authorities from across British Columbia on the BC Learning Hub initiative. Now, what we're really here to talk about today, and we have just a few minutes to talk about this, so I'm just going to talk about what I see as some of the potential big ways that mobile technologies can be used for just-in-time learning for emergency healthcare professionals, as well as for just-in-time learning for patients in emergency healthcare contexts. Now, we've actually been using mobile technologies to deliver just-in-time training with healthcare professionals for a number of years. My apologies for the very grainy screenshot here, but this is from a paper that dates back to 2009, looking at some research, I believe around the 2006 period, with using mobile technologies for rural nurse education in clinical settings. Nowadays, we have things a little more streamlined and a little prettier looking. We can deliver training, customized training via our own mobile devices rather than some of these customized PDA devices that were used back in the early 2000s. We can also leverage a number of apps that are available on the commercial market, some of them free, some of them for small fees, with ready-made access to professional development training and to resources to teach us various facts, figures, anything that we'd need to know in a clinical setting. Now, all of these are great. I have also spent some time developing and teaching others how to develop their own customized applications for mobile devices using things even as simple as Google Forms and QR code readers. Now, all of these things are great, but they do have one drawback, and that's that they take your attention out of your immediate surrounding, and they don't necessarily give you the information that you need in the immediate context, especially in an emerging situation in an ER setting. Now, I see technology with mobile devices as evolving so that we can bring the devices into the setting and bring the setting more to life. We've all seen what happened a couple of years ago with the introduction of the Pokemon Go game. I've had some discussions with some colleagues, and I see great potential for easily developing similar games to bring augmented reality into our workplace, such as this mock-up here of a Pokemon Go-like game where you look around a clinical setting and you identify potential sources of contamination or infection. Great way for teaching our clinicians how to spot those things in an actual clinical environment and to really bring it to life for them. But again, this is not so much education, just-in-time training for an emergency context. I see augmented reality as taking that one step further to the next level for us. Now, we've seen Google Glass. We saw it come and go. It was a bit before its time, but the concept of using augmented reality and having it appear before us and freeing up our hands is not a new one. It was previously the stuff of science fiction. It's becoming more and more the thing of reality. And I see this as having huge potential for just-in-time training in emergency room contexts. Imagine being in an emergency room setting, needing to perform a procedure, and in the past you would have to wait for an expert consult to show up to show you how to do that procedure that you've never done before. Well, with augmented reality, you could share what you are seeing with a remote expert. You could each share the exact same view, provide each other with instant feedback and advice, and be able to carry out those procedures and learn how to do those procedures in real time, providing real-time care to your patients in a clinical setting. Now, what about our patients? How can mobile technologies help our patients in a healthcare setting? Well, one of the biggest problems that we have always had in a healthcare setting, especially in a diverse country like Canada, is communicating with our patients, making sure that they learn what we need them to learn before we discharge them, or making sure they fully understand what it is that we're trying to explain to them, or the questions that we're trying to ask them. With new technologies emerging on the market, we can now leverage mobile devices for instant translation capabilities. I know some work has been done in the BC Lower Mainland on this in some of our clinical settings, emergency room settings, experimenting with mobile devices and customized applications to see how well we could offer those translation services to our patients, how that improved the understanding of communications between clinicians and patients, and how it improved our ability to actually receive informed consent before providing procedures to our patients. There's new commercial apps coming on the market too that would bridge this communications gap. Apple has received a lot of fanfare for their Apple Health Records app. It's been adopted by a few major healthcare centers in the United States. It's an app that would allow you to communicate to anyone in an emergency setting or any clinical setting all of your health information. So even if you're not conscious, your clinician can then learn in the moment what they need to know about you in order to provide you with the best health care. We can also leverage mobile devices to show our patients what we need them to know before we discharge them, how they can care for themselves, how their family members can care for themselves, how they can manage their ongoing care in a real-time manner so that they don't need to keep coming back into clinical settings. They can get it on their own devices and take it with them. Another way that we can leverage mobile technologies is to learn in real time how we are doing in our services that we provide to our patients. And there's been some work done in the BC Lower Mainland. I know that the Fraser Health Authority was actually leading the charge on some of this work with real-time patient surveys, leveraging mobile technologies to bring feedback surveys to patients and gather that data in real time rather than waiting for a long turnaround time to get that data back. In real time, we can see exactly how we are doing, where some of our pain points are throughout the health authority, and things that we need to respond to in real time so that we can provide better care to our patients. I believe that this as well is something that we can bring into the emergency room, not just to our long-term patient care facilities. Now, if we're going to be leveraging mobile technologies in an emergency room context, emergency healthcare context, there are some pitfalls that we need to watch out for. I like to think of it as a trifecta of pitfalls, three big things that we need to watch out for. One concern with bringing mobile devices into any clinical setting is the potential for an invasion of privacy for our patients. Even if we're not invading our privacy, there could be that perception that we are. We have the ability to take pictures. We have the ability to share information. If we're using our own devices, we have the ability for breaches of that confidential patient information. So we need to be very careful how we tread with that. There's also the potential for perceptions that we are not paying attention to our patients, that we're too distracted by our technologies, and we're ignoring our patients. So if we're going to be bringing mobile technologies in and using them as a teaching and learning tool in real-time emergency room settings, we need to make sure that we're communicating about how we're using those technologies. There's also the danger that bringing these technologies into an emergency room setting could cause real harm to our patients. One way that it could cause real harm to our patients is by being a distraction to us. If we're too focused on the technologies, we could make mistakes in our dealings with our patients. There's also the dangers that come with bringing our own devices into emergency room settings. Simply from an infection prevention and control standpoint, we need to make sure that if we are using mobile devices in any clinical setting, that they're sterile, that they do not pose a health risk to our patients. Finally, the biggest pitfall that we need to make sure of when we're bringing any technologies into any teaching and learning setting is we need to make sure that we are fully compliant with any digital accessibility legislation or restrictions or requirements that are in place in our jurisdiction. Now, there is no federal requirements in place for this in Canada at this point, but there are talks underway of developing federal digital accessibility standards. There are digital accessibility standards that will be coming into force in British Columbia as of 2024. Many other jurisdictions across Canada have already adopted these requirements. So if we're going to be using mobile technologies as teaching and learning tools, we need to make sure that anything we create, anything we use meets basic digital accessibility requirements, and that the teaching and learning tools that we develop using mobile technologies don't actually isolate any of our potential learners and create further problems for them. Thank you very much for your time.